Okay, here's my audience member. And here we go. Okay, making sure they can see me good. Maybe not. It's better. Okay, today I'm going to talk to you about paramedics. So, I want to talk to you a little bit about what paramedics actually do. It's kind of confusing for most people on who is a paramedic, who's an EMT. Um, I've been a paramedic since 2020, and I've been an EMT since 2016. So I've been in the field for about 8 years. I feel pretty confident talking about it. Um, what most people think our job is kind of just going to the house. They don't know who's in charge, um, but going to the house, first person on the scene, and we are there to help everyone. We're kind of the Swiss Army knife of medicine. People, we need to be able to respond to all different kinds of scenarios and different kinds of scenes. Um, and today I really want to talk about the training of pre-hospital care providers from EMTs to paramedics, the duties of paramedics, and the future of the career. So, training wise, everyone kind of starts out going through EMT school and advanced EMT school. Those are the two prior steps before becoming a paramedic. To do that, it's around 12 to 18 months and a few hundred hours of classroom and clinical time. So to do that, you have to go to a technical college or the place you work at sends you through their program. Um, and then when you're done with that, you can decide to go to paramedic school. Paramedic school is another 12 to 18 months on top of that, and it gets way more complex at that point. When you go to paramedic school, you have to do around 600 hours of clinicals. It's a pretty long stretch of school. You have to do clinicals in the OR, ER, ICU, stress lab, and you have to meet a whole bunch of requirements. You have to deliver a certain amount of babies, intubate a certain amount of patients, deal with a certain amount of critical patients by yourself as the person in charge. You have to be able to read and comprehend EKGs. It's a fair amount to go through school, be competent at it. Once you're done with school, you get to go and do the duties of a paramedic. So the duties of a paramedic are truly you're the first line of medical care for this patient most of the time. So you are there to evaluate the patient, start them on whatever medications and processes you need to. Um, the way a call usually goes is there's one paramedic and there is three EMTs. So usually you have an EMT partner or an advanced EMT partner that is driving you to the calls, and then there's another apparatus like a fire truck that meets you there, and that is the team that goes to these calls. The paramedic is kind of the quarterback. They're in charge. They kind of direct the EMTs what to do or what not to do on these scenes. But you start IVs, take blood pressures, and your job is to basically stabilize this patient, get as much information about this patient as you can, and then take them to the appropriate facilities. It gets a little complex because you never know if you're going to be at a nursing home or if you're going to be a mile into the woods with someone that broke their leg. So you kind of have to be ready to deal with all kinds of calls. And that's why I think we're kind of the Swiss Army men of the medicine world. Duties of, we talked about duties. Now I want to talk about the future of paramedics. So the future is kind of cool. Paramedics are relatively new as we know them. It started in 1969 in Miami, and that was this basically the start of paramedics. These people were starting to give drugs, starting to do 12 leads. They were starting to be providers in the field. They're not just driving sick patients to the hospital. They're actually starting to treat these patients in the field before they go. But since it started now, today, a lot of our paramedics are being used in the hospitals. So they're being used in places like the EVOR, and then a lot of these are specialty places. So the EVOR, specialty, cath, neuro, um, they're being used in the ER. But when they're used in like the cath lab or EVOR, the Paramedics stand next to the doctor, they scrub in and they help the doctor with the procedure. Um, but it's a super bright future. There's also a new thing called community paramedicine where they hire these paramedics and train them and they send them to recently discharged patients' homes from the hospital. That way these patients can ask these providers, these paramedics, any questions. They can do vitals, do assessment. They can basically do a checkup on this patient without them having to come back to the hospital and get readmitted. And then we have critical care paramedics and helicopters. And the way the future in paramedic is going is really bright and really cool. Um, and the conclusion I really want to talk about is that we are the Swiss Army knives of medicine. We kind of do all this stuff. Um, Going through school, the three levels, the EMT, EMTA, paramedic, we are the first providers, but we're the detectives on the scene trying to make sure we can see everything and organize everything for the doctors in the ER. And the future is super bright in paramedicine. So I hope you got to watch this and understand a little bit more of paramedicine. Have a great day.